Have you ever been treated for syphilis, gone for a follow-up test, and been shocked to see the word positive still on your report? You might think, wait a minute, I took all my medicine? I did everything right. Why does it still say I have it? It's a super confusing and stressful situation, but let me explain what's really going on. It's not what you think. Syphilis testing is different from many other infections. When you get infected, your body produces antibodies to fight the bacteria. Most tests for syphilis don't look for the bacteria itself. They look for these antibodies. And here's the key part. Even after the bacteria are completely gone, these antibodies can stick around in your blood for a very, very long time, sometimes for life. So, when you see a positive result after treatment, it doesn't mean you're still infected or contagious. It just means your body remembers the infection. This is where two specific tests, the RPR and the VDRL, come into play. These are what we call non-troponemal tests, and they're crucial for monitoring treatment. Think of RPR and VDRL as tests that measure the activity level of the infection. They don't just give a simple positive or negative result. They give a titers. A titers is a ratio, like 1 to 16, 1 to 32, or 1 to 64. A higher number, like 1 to 64, suggests a more active infection. When you first get diagnosed, your doctor will get a baseline titers. This is our starting point. After you receive treatment, like a penicillin shot, we expect this titers to go down. The goal is to see a fourfold decrease. So, if you started at 1 to 64, a good response would be a drop to 1 to 16 or lower within a few months. This drop tells your doctor that the treatment is working beautifully, the bacteria are being wiped out, and your body's immune response is calming down. Now, you might be wondering, what's the difference between RPR and VDRL? Clinically, for most people, they're very similar. RPR stands for Rapid Plasma Reagin, and it's done on a blood sample. It's fast and widely used. VDRL, or Venereal Disease Research Laboratory test, can be done on blood or on cerebrospinal fluid, which is the fluid around your brain and spinal cord. This makes VDRL especially important if doctors are concerned the infection has spread to the nervous system, a condition called syphilis. But for routine screening and treatment follow-up, RPR is usually the go-to test. So, why do we keep testing you after treatment? Because we need to make sure that titers keeps dropping and stays low. If the titers doesn't drop, or if it starts to go back up after it has dropped, it could mean one of two things. It could signal that the treatment didn't work completely, which is rare but possible. Or, more commonly, it could mean you've been reinfected. That's why your doctor will want to check your RPR or VDRL titers at 3, 6, and 12 months after treatment. This continued monitoring is essential to confirm you're truly cured and to catch any new infection early. Over time, for many people, the RPR or VDRL titers will drop so low that it becomes non-reactive, which is basically a negative. But for some, it might stay at a very low, stable level for years. A state we call this serifast state is not a sign of active disease and doesn't require more treatment, as long as the titers remains low and stable. So, that positive on your report isn't a sign of failure. It's just a part of the long story your immune system tells. The important thing isn't the positive or negative, but the number the titers and its trend over time. Understanding this can take a lot of the fear and confusion out of the follow-up process. Always talk to your doctor about your results so you understand what they mean for you. Thanks for watching. If you found this helpful, please like this video and subscribe for more clear health explanations. See you next time.